A dangerous international gang member arrested in South Florida.
The MS-13 gang is considered one of the worst in the world and often try to infiltrate in communities where they can fly under the radar. As CBS 12's Al Pefley reports, this latest member has already been deported once before.
Border Patrol agents say they arrested an El Salvadorian national near Fort Lauderdale September 10th. They say he was previously deported from the U.S., but somehow found his way back here into this country.
They're probably one of the most revered and feared international gangs, and certainly here in the United States.
Former FBI agent Stuart Kaplan, who now works as a criminal defense attorney, spent 15 years with the FBI. He says the fact that a documented MS-13 gang member from El Salvador has been nabbed in South Florida should be of concern.
And there is no doubt that MS-13, given their history of violence, that it can and will and does affect our safety here.
MS-13 is a notorious street gang known to have terrorized El Salvador and parts of Central America.
Mr. Fuentes, you are here on a first-degree murder charge.
Several years ago, 6 alleged members of MS-13 were charged in 2 South Florida murders in Palm Beach County.
Their intent wasn't just to rob, but rob and murder.
MS-13 has spread to several states. There are believed to be at least 10,000 members living in various communities across the U.S.
These gang members aren't large in numbers compared to other gangs, but when they act out, they're extremely violent.
Experts say MS-13 has been linked to murder, murder for hire, extortion, drugs, sex trafficking, and child pornography. They often target the migrant population, knowing there's little chance their victims will report the crime to police because they're in the U.S. illegally and don't want to risk being deported. And some believe MS-13 is now a growing threat in the U.S. because of the relative ease of gang members to slip across the southern border with Mexico and enter the United States.
Well, certainly, I think with the issues at the border, there is no doubt it's on the increase because you basically have a lack of enforcement at the borders now. With respect to people just coming across the borders, in droves.
A Border Patrol spokesman said they could not release any details on the arrest of the MS-13 gang member, including his name, saying it's an active investigation and to release details now could jeopardize the case. He did say it's a significant arrest that could lead to other arrests. In West Palm Beach, Al Pefley, CBS 12 News.
Back in 2019, an MS-13 gang member shot an undercover PBSO agent in the face in Palm Beach Gardens. That deputy has recovered. The 32-year-old gang member was shot and killed by nearby deputies.
And MS-13 started in Los Angeles in the 1980s, and as Al mentioned, the gang now has more than 10,000 members in at least 40 states and the District of Columbia. Now to the coronavirus crisis. For months, Florida would show you the total of COVID deaths, but it wouldn't be broken down by county.
Suddenly, on Tuesday, the state went back to reporting it to federal health agencies. CBS 12's Andrew Lofholm breaks down the new numbers for our entire viewing area.
These are maps that the CDC puts together to break down different data across the country when it comes to COVID. Now, this looks at deaths by county all across the country, but check out Florida all in white, meaning no data is coming from the state when it comes to counties. This is what it's been like in Florida for the last 3 months or so. But just yesterday, you can see here, Florida once again showing that information broken down by each county. About a month after the state halted county-by-county death data, Florida began what would become its worst stretch of the pandemic. Cases peaked and nearly 3,000 Floridians died. But what we didn't know until now is where they were dying in Florida. Dr. Clifford A. Almeida is an infectious disease specialist at the JFK Medical Center. How important is it for the public to be able to see these numbers to how many people are dying in each county in Florida?
I think that increasing transparency is fundamental to give the population security that our officials are not trying to hide any facts, and they are giving us the information as they see it.
So how many people died in our 5-county viewing area since June when they stopped breaking down those COVID deaths by county? Well, I did the math looking at the difference from June to this most recent number. You add all these numbers up, 786 people died from COVID.
We expect to see a rise in the number of deaths related to the rise that we experienced a couple of weeks ago with the Delta variant.
How important is all this information to be able to have each person make what they think is the best decision for them?
If we're going to say that our citizens should be able to make decisions about mask wearing, about sending their children to school, about frequenting certain places. We should at least equip the citizens with information that will allow them to be better informed.
On the heels of this data coming out, AARP reporting Florida leading the nation in both nursing home resident and staff deaths from mid-August to mid-September.
I want to turn to the COVID pandemic, which has now claimed the lives of 1 in every 500 Americans. For those 85 years old or older, it's 1 in every 35. Most of the people dying at this moment are unvaccinated, and most of the people in the hospital, they are also unvaccinated. Some more perspective here. At the same time, the government just announced a new contract with Regeneron for 1.4 million additional doses of the company's monoclonal antibody treatment. This treatment's in such high demand that last month another company that makes a similar treatment reported a global shortage of their drug, and Florida could soon see a cutback on its monoclonal antibody supply. We're bringing in Madeline Montgomery here, live from Palm Beach Gardens Medical Center. So, Maddie, why could we see our supply reduced?
Ashley, it's because the federal government is now equally distributing the treatment instead of taking orders, if you will, giving states what they ask for. So, for instance, according to Governor DeSantis' office, the state requires roughly 72,000 doses a week to be used between hospitals and clinics. The Department of Health confirms that this week the Fed sent roughly 30,000 doses to the state. The state even has its own sites for the treatment set up, and at those 25 sites, 87,000 doses of monoclonal antibodies have been administered. So what even is this therapy? It's an FDA-approved way to lessen COVID symptoms and prevent hospitalizations. The antibodies are made in labs and help prevent the virus from attaching to and entering human cells.
If we're going to say that our citizens should be able to make decisions about mask wearing, about sending their children to school, about frequenting certain places, we should at least equip the citizens with information that will allow them to be better informed.
The health department says we're running low on doses because of states with low vaccination rates. They're ordering more and more doses because so many people are catching the coronavirus, specifically the Delta variant.